Everyone to the fifth MIP Lung Health Group event on pulmonary hypertension, ahead of the upcoming World Pulmonary Hypertension Day that will be held on the 5th May. I am Carlos Robolo Cordeiro, pulmonologist in Portugal and DRS Vice President, and it is my pleasure to moderate this event on pulmonary hypertension, a rare, serious, and complex disease for which the EU funding research can be a fundamental support for people living with this disease. And that's why updating incentives in the upcoming revision of the EU rare disorders legislation is crucial. So I think we are really on time for this. Some housekeeping, this session is being recorded, and I will ask all the participants, I will encourage you to introduce your questions in the Q&A. You have the program in the screen, and so it is now my honor to introduce the member of the European Parliament, Maria da Graça Carvalho from Portugal. That Maria da Graça Carvalho will deliver the presentation, the introductory remarks. So please, Professor Graça Carvalho, it's my pleasure and honor to listen to your talk.
Good afternoon. Thank you very much for the invitation. I'm delighted to be co-host of such an important event, and I want to thank the MEP Lung Health Group and the European Respiratory Society and its president and vice president for the kind invitation. I also want to give a special word to Professor Carlos Robalo Cordeiro, that is moderating this event, and it is a very prestigious and very well-known researcher and medical doctor and professor of medicine in Portugal. So it's an honor to be with you today. I will devote my first introductory remarks to research and health-related research that I have devoted a lot of my work during the previous mandate in the European Parliament and in this mandate also. And more than ever, it's now obvious that health research is of utmost importance for Europe and for humanity. COVID-19 has highlighted how fragile our healthcare system can be and how crucial is to invest continuously in research in the health sector. But we have reasons in Europe to be proud, and I'm particularly proud of the fact that one of the vaccines that have been developed and has been one of the successful endeavors during the COVID-19 has been mainly co-financed by the different European framework programs. And I'm referring to the BioNTech vaccine, that the technology that they are using has been very much co-financed, I suppose, since the FP5 and continues FP6, FP7, and recently they had a European Research Council grant for the development of the mRNA technology for cancer vaccines. And was this constant and sustainable investment from the European Commission, but also for the member state where they were located in Germany, that allow that in less than 1 year they were able to develop the vaccine. This compared with 43 years to get the vaccine for Ebola and 16 years for hepatitis. And the difference is that we were investing in this subject even before we knew what was the real value of this investment. And this is the reason we should continue to invest in fundamental research. It's very important that we do it in a sustainable and consistent investment in basic research. And also what has proven these times during COVID-19 is that the cooperation and the collaboration at European level and beyond the European level with the rest of the world is also very important. And we need to improve the coordination of the research that we do at the member states level and the European level. Rare diseases is a good example of this coordination. I'm also quite proud that in Horizon, when I was the rapporteur of the specific program of Horizon 2020, I have introduced as priority rare diseases, and this has allowed that rare diseases research has been several projects have been funded by Horizon 2020, and we were able to also to finance and to promote international cooperation on rare disease. And I suppose our speaker from the European Commission will talk about this. And we have to continue on this way, investing in research, promoting cooperation between member states and the European level, and to promote international cooperation. When I was rapporteur of Horizon 2020, we tried to push the idea of having a body like a European Research Council for Health that would help to promote the collaboration on health research. This was not possible because it was not accepted by the Council, but we managed to create what we call the scientific panel for health that have been discussing this and pushing in the member states at the end and at the European level this idea of the importance of research and the collaboration between the member states and the European level. So the seeds for this idea were there, and we kept pushing this idea during all these years. And I was quite happy when our the President of the European Commission, Mrs. van der Leyen, has announced the European Health Emergency Preparedness and Response Agency, ERA. It is, or it may be a step in the right direction if there is ambitions in the content. Now, during these months, there are months that are very important because Commission is developing what would be this agency. And there are several possibilities. We can have a less ambitious agency, important, but that deals with preparing and handling the response to a crisis. It's very important, but we can go further and we can be more ambitious than that. We think that, I think at least, and on that, many colleagues in the European Parliament are of the same idea that these agents should be a real European body that promotes the biomedical research and development, an agency that really pushes this cooperation in the biomedical area. Because there are many other challenges that we need to share between the member states and the European level. And there is many areas, not only the pandemic, that we need to deal in altogether. Rare diseases in general is one of them. So that we look forward, and we have been putting pressure from the side of Parliament that what will come out in the end of this year as the ERA, as the content and the purpose of ERA will be ambitious enough to promote the research. But we have still other tasks to do at the European level. In order that the investments are transformed in knowledge, the knowledge is transformed into products, solutions, therapies, medicines that arrive to the patients and to the people in a fast way, that are affordable and that they are efficient. We need to have an ecosystem of health that is well prepared, that promotes innovation, that doesn't create barriers, that doesn't over-regulate, and is less bureaucratic, and has less market fragmentation. And in this, we also have a lot to do. Less market fragmentation, less bureaucracy, less barriers to innovation, because it still is taking a long time for the knowledge that we developed in research arrive to the patients in terms of solutions for the patients. And we probably also during this year, many things will come out, and one of them is the data, the regulation of data, and we expect, and this is another point that a lot of homework needs to be done. We expect that part of the documents that will come out from the Commission are devoted to the health data. Is also an area that is still poses major problems in the member states and in the European Union. We don't have a common standards, we don't have a common platform, even at member states, some member states level. And to gather data, to be able to share data in an easy way, for the researchers, for the medical doctors, is very important for to promote faster research and to promote that we get results and develop knowledge at in a faster way. So we also need very good regulations and very good conditions to create a real European data space. So in the end, is a lot of areas that we need to work, and we need to work fast. And our goal should be to develop knowledge and to be able to use and to deliver this knowledge and to transform it into accessible, affordable, and efficient solutions for all our citizens. I look forward to hear ideas from the discussion today, and how to accelerate further the EU research, and how to transform the results of EU research in solutions, in this case for rare diseases that are so important. These solutions, they are rare, but the number is still an expressive number, and these people are waiting for our solutions and to improve their condition and their well-being. So thank you very much for the invitation. Thanks again.
Thank you, Professor Graça Carvalho. It's us that have to thank you for this excellent and truly important introduction, and thank you for this opportunity. Thank you. And so it is my pleasure now to introduce Cristina Kyriakopoulou. She's a senior policy officer on rare disease, health data and data analytics from DG Research. And we are looking forward hearing your presentation on new opportunities for rare diseases. Thank you, Cristina. The stage is yours.
Good afternoon. It's a great pleasure to be here. Dear honorable members of the European Parliament, Madame Carvalho and Mr. Cordeiro, sorry for mixing the name. Thank you very much for giving me the opportunity to present very laconically, I would say, telegraphically, some highlights for the next framework program of the European Union for research and innovation, and with a particular focus on rare diseases, on health research and rare diseases. And I'm trying to progress my slides now. Yes, I think I will manage. So if I present myself, I'm working as a senior policy officer in the Directorate General of Research and Innovation at the European Commission. at the unit, which is newly formed since 1st of April, which is called Health Innovations and Ecosystems. So the structure of my presentation, I will try to give some highlights of the history of the EU support to research on rare diseases, the rationale and the aims of Horizon Europe very telegraphically, the aims of the health cluster in Horizon Europe, and the new elements of Horizon Europe with regard to the European partnerships. And if I go to the next slide, I'll see that for the history of the support, traditionally, during the last 20 years, and in particularly during the last 14 years, and I'll try to progress my slides, sorry. Yes, you can. We have at the European Union, we have invested in the last 14 years, from 2007, from the Framework Program 7 program until H 2020, Horizon 2020, until 2020, 14 years, more than 800 research and innovation projects have been funded with more than 2.4 billion euro, both for single beneficiaries projects funded by the European Research Council, Marie Curie fellowships, the Marie Curie training network program, and also a large amount, a large bulk of this funding, it goes to the health collaborative research. This means the formation of interdisciplinary groups from Europe, transnationally across different countries, with bringing different expertise from basic research to clinical research to support to small and medium enterprises and innovation, different innovation actions. And in this graph, I'm just, there's a graphical representation of the number of health research collaborative projects, which forms networks and consortia across Europe in the last 14 years, which represents more than 1.8 billion investment in more than 320 collaborative projects. And I will go to the next slide where I just want to give you a flash of the different allocation of the EU funding in the health collaborative part of the program in different medical areas as defined by the ICD-10 codification. So I wanted to see that in the left graph, you can see the different areas with the orange. You can see, for example, the certain infectious and parasitic rare diseases is funded. And in the left graph is the H 2020 Horizon funding. Then we can go to the green bar, to the green part of the pie, which it's devoted to endocrine and nutritional metabolic diseases. A lower part on respiratory disease with the dark blue, 2%, and a larger part to disease of the neurological and neurodegenerative. So you see that, but please, this we are doing a massive analysis of all the 800 projects to really categorize in the really all the medical categories. So it might be modified, this part. So if I go if I go to the next slide, I'll see that there is historically there is a huge support for rare diseases at the European framework programs. And there is also the history of the coordination and alignment of the national funding programs in rare diseases. And if you are familiar, this is the very well known since at least 20 years, the ERANET type of program, which is a partnership between funders to create, to mobilize more national funding for joint calls for transnational interdisciplinary projects. And if we follow this evolution, we come in the milestone of 2019 in the next slide, where we see the fame, I have seen it also commented in your different documents, the European Joint Program on Rare Diseases, which is with a 55 million EU contribution, and a total investment from several funding bodies from more than 35 countries across the world, to create this research and innovation ecosystem for the rapid translation of the research results into clinical applications and the uptake in health research. So this is kind of an ecosystem that recently I heard it creates links to at least 80% of the rare disease research community and clinical centers in Europe. And this one large of the funding goes to joint calls in different researchers, preclinical research, clinical research, different collaboration between industry, innovation activities, but also creates a very large infrastructural element, which is called virtual platform. And a large element of that is the link of the different databases, resources, patient registries, which is represented by the 24 European reference networks, in order to be able to bridge this research world and clinical world and healthcare to accelerate the translation of the research results to the healthcare ultimately. And I will invite you, our dear attendees, ladies and gentlemen, to have a look at this website, because there are very interesting training modules, interdisciplinary. There is one announced on diagnostics recently. There is a lot of networking events, not only from members of this consortium, but for external community to be able to enlarge the community. And if I go to the next slide, and I think I'm really I would like to refer to the International Rare Diseases Consortium. Again, you have a look at the website, which includes 6 international partners across 5 continents, a lot of public funders. European Commission is a member, National Institute of Health departments is a member, several European countries, as you see. And there you can see also potential opportunities to participate or to have an expression of interest as an expert in different task forces, which are forward looking on the gaps and the needs of rare disease research. And if I go to the next slide, and I go to the framework program, and allow me to, and the next slide, sorry. I will say that the framework, the Horizon Europe, the next framework program, will devote 95.5 billion euros in the period 2021-2027. And the main drivers of this framework is to support the EU scientific and technological excellence, to strengthen the European reference research area, to tackle policy priorities which have been established for the whole European Union, including green and digital transition, and most importantly, the research and innovation action at the European level support the overall goals of the European Union, which is also committed to contribute to the sustainable development goals of the UN. And also one other aim and objective of the program, it is to boost Europe's innovation uptake, competitiveness, and job, and support the economy as it has all been transnationally been. And in the next slide, if I go, I will pass by this. This is more information about what I said on the policy main objectives of the program. And if I run the slides, you will see that we have several pillars. One pillar is called excellent science, the evolution of the European Research Council. The pillar that is called global challenges and European industry competitiveness. This is where, if I go in the next slide, the health research traditional program of approximately 8 billion euro for the 7 years period, it's traditionally grouped. And if I go to the next program, with regards to cluster 1 health, next one slide. I would like to emphasize that if one would say one word, what is about a characteristic which is emphasized in Horizon Europe, it is the impact. So all the research and innovation activities, they are designed, the work programs, towards the final impact. And for that, a methodology related to key impact pathways is going to be used in order to be able to assess the scientific impact, the societal impact, and the economic impact of the actions in the research and innovation at the European Union level. And if I go to the next slide, I refer to the cluster of health. In the cluster of health, the aims is to contribute to the promotion of social cohesion and inclusiveness and the health and well-being of people, to develop an economy that works for people, and to make healthcare systems more accessible. These are the overall strategic objectives. And under that, several, in the past, possibilities for rare diseases research can be envisaged. And in the next big important aspect is the partnerships, the European partnerships on rare diseases. And as you have heard, there is a new type of strategic definement of new type of partnerships, which are either public-public or public-private partnerships. And if I go to the next slide, I will just give you a highlight why we want European partnerships, one of which will be the European Partnership on Rare Diseases that will be published in the Work Programme 2023 and will be launched in 2024. Horizon would like to support the next generation of European partnerships to deliver on global challenges and to take a systemic approach on an ecosystem approach in the achievement of the objectives. And the European partners should also provide possibilities to strengthen the synergies between national and regional programs, also to be able to contribute and to create all this ecosystem of the innovation cycle from the discovery up to the market, all possibility of integrated type of activity to support, and also a higher impact, as I said, for the Horizon Europe. And if I may, just partnerships will have to build important synergies with other European unions, like the Connecting Europe facility, the structural funds, the EU for Health program. And I have given you some links in the slides where you can have a look at these programs. And in the next slide, please. Next slide. I just come to this final conclusion that the partnerships on rare diseases, which will be the continuation of or built on the achievement of the European Joint Programme on Rare Diseases, with most of the funding agencies and political commitment from the member states, it will aim the research and innovation knowledge and activities to improve ultimately the lives of people living with rare diseases. And there it will be a major funding has not been decided. The discussions with the member states, because it will be led and coordinated with the initiative of the member states funding bodies, will start in April. And it will be a maturation period to develop a strategic and research innovation agenda, the basic objectives for which to launch the partnership in 2024. And I think I stop here because I passed my time.
Oh, thank you, Christina. This was, you want to say something else, please?
Yes, I would like also to say that there is a big opportunity in other type of health partnerships, like the so-called IHI, Innovative Health Initiative, where for the first time you bridge different technology sectors, pharma companies, medical imaging, medical technology, digital tools, to come together to address challenges in several research, several diseases. And in this time, it is included also rare diseases. Not specific devoted programs, but it will have the possibility to support also rare diseases. So this is another partnership that will launch future call for proposals. And thank you very much. I'm sorry for being running to.
No, thank you, Christine. It was fantastic. I think it is, you showed us a very important date on these new opportunities for the rare lung diseases. And if you agree, we can discuss this presentation together with the next one.
Thank you very much.
For you. Thank
it
you.
It has been an honor for me.
Okay,
Thank you.
we will be back. So it is now my pleasure to introduce all of you. Professor Marc Humbert. Marc Humbert is the ERS president-elect, so he will take the lead after September. As you know, he is working for several years on rare diseases, especially on pulmonary hypertension. So he will speak on, I can imagine, mainly on the European reference network on rare diseases, especially on pulmonary hypertension. So Marc, the stage is yours, and it is a great pleasure to listen to your talk.
Thank you very much, Carlos, for your very kind introduction, and thank you to ERS, to ELF, and to PHA Europe for putting pulmonary hypertension in the spotlight with our MEP hosts. So I will first disclose that my institute, of course, develops a lot of innovations in the field of pulmonary hypertension and has links with companies with an interest in the field. And you will see later that this rare disease, pulmonary hypertension, has been quite successful in bridging basic research with medical research and offering new solutions for our patients with a devastating condition. So, as you said, Carlos, I will focus a large part of my talk on the European Reference Network for Rare Lung Disease, or ERN-Lung, which is a very important instrument developed thanks to the EU, and which has a mission. The mission is to build a network of European healthcare providers dedicated to ensuring and promoting excellence in care and research to the benefit of patients affected by rare respiratory diseases. The vision is to have a European knowledge hub for these rare respiratory diseases. If you take one rare disease alone, it is rare. If you take all the rare respiratory diseases together, as we heard at the beginning, it becomes a large collective of patients, families, doctors, researchers. And I think this initiative was extremely positive for rare disease organization, research, and new solutions for our patients. So as you know, ERN-Lung has been labeled in 2017 for 5 years. And it was really an opportunity to improve cross-border collaborations, cross-border care, reinforce research, epidemiological surveillance, promote registries, clinical trials, provide training for healthcare professionals, and allow high quality and accurate information on rare respiratory diseases. So altogether, I think this initiative was outstanding, and it was not only for the lung, it was of course universal in health for rare lung diseases. And with Professor Thomas Wagner, who is a coordinator, and I was a vice coordinator in Paris, we have built together core networks with rare conditions as being the cornerstone of these core networks. And on the left-hand side, functional committees, which are more transversal. So if you look at the core network, there are many rare lung diseases, you know, like cystic fibrosis, like idiopathic pulmonary fibrosis, but also like pulmonary hypertension. And on the left-hand side, you see the functional committees which correspond to our priorities, which should link together all the core networks. So ethics, registries, clinical trials, guideline, quality, cross-border care, communication, training, CME. So this was a nice initiative, and the core networks are built to develop specific plans for their disease groups. So for pulmonary hypertension, we had some priorities, and I will share them with you. And we have activities with a very, very close partnership with the patients and the patient organizations. On the right-hand side, the functional committees, they promote the interoperability of the core networks in areas that have been recognized. For example, registries, clinical trials, guidelines. And we have deliverables, and we have to implement the work packages in the reference network. So this is a map of Europe, and you see when we started in 2017, rare disease organization was stronger in the western part and in the northern part of Europe, and now one of our priority is to spread throughout Europe. And we have, thanks to our patient representative, Gergely Messaros from PHA Europe, a very good collaboration with patients with regular discussions, regular phone calls, and initiatives like today. Pulmonary arterial hypertension, it's a very rare disease. Many people have never heard of it, but it is not an orphan disease thanks to very strong research and very strong commitment of patient organization, learned societies, and pharmaceutical companies. It's rare. The prevalence is around 15 to 50 per million, depending on the registries. The pathophysiology is interesting because there is a key abnormality of the cells which are at the lining of the vessels. It's called pulmonary endothelial cells. And thanks to the very good understanding, thanks to basic research of the function of these cells, 14 drugs have been approved for this very rare disease in the last 25 years with an orphan drug status. And still now, we do offer transplantation for patients who are refractory to medical therapy. Transplantation is either lung transplantation or heart and lung transplantation. So I would like to acknowledge here the strong influence of very strong basic scientists who have discovered major functions of the pulmonary vessels. And in less than 10 years after each discovery, there was one major publication in major journals like the New England Journal of Medicine, leading to new therapies available for our patients in our clinics throughout Europe. So we have major opportunities, and with the EU, we have, of course, the ERNs, and we thank the EU for building that and for offering us new perspectives in the future, thanks to the EU for Health, Horizon Europe, and the new European Research Council. Clearly, we have also major opportunities with the European Union and the European Respiratory Society. And the European Respiratory Society is a very strong society, very committed to care and research and education. And you see here that we have a lot of proposals. I'm not going to read through that, but we have a big congress, and we are able to do it remotely when needed because of the pandemic. And we have also strong clinical research collaborations, which echo very well what we build in the ERN lung. And we will hear Dr. Kovacs presenting one of these clinical research collaborations in a few minutes. We have also a strong commitment with the Learn Society, the European Respiratory Society, the European Society for Cardiology. We do build guidelines together. And the ERN lung and the ERNs are very, very much interested by these guidelines, which are unique in the world, which are used broadly at large in Europe and also in other continents. And these guidelines are a pride of our societies and will certainly be supported by European Reference Network. So we have major opportunities together with EU and ERS. We build task forces at the ERS level, and Professor Delcroix will discuss another form of hypertension in a minute. And we have these clinical research collaboration, which are certainly a very good platform to propose to the EU new projects very soon. So building more collaboration between ERN lung and ERS, we have a memorandum of understanding, which is now in place since 2019. And our current president, Professor Simons, has been involved quite a lot in recent discussion with the ERN. And we have a lot of activities together with the ERN lung. just a few comments about COVID-19 and rare lung diseases. We have done a webinar also on Ctf, clinical training fellowship. It's currently on hold due to the pandemic, but we will relaunch very soon, and a lot of education programs. So my last slide is to once again thank you very much for putting a rare disease like pulmonary hypertension in the spotlight, and many thanks to the MEP and to you, Carlos, for welcoming us at this outstanding meeting. Thank you very much.
Thank you, Mark, for this excellent overview. I'm sure that in your next presidency of ERS, this will be a major focus of your work. And so if you both, Christine and Mark, will be happy to answer some questions, we can have now a short 5-minute period of discussion. I'm waiting for questions coming from the participants, but not yet. Maybe I will start, Christina, to you. So from all the possibilities you showed us, there was a enormous amount of possibilities and of funding for this, also for these rare diseases. Do you think that with this Horizon Europe, this can be a good opportunity for to increase funding for rare diseases as compared to the previous programs, namely Horizon 2020?
Yes, you know, this is quite challenging to reply, because there are a lot of cross-cutting horizontal calls for proposals, which are broad, and several of rare diseases subjects or in different rare diseases can come for application. I'm just saying there is a series of potential calls for proposals, not necessarily devoted to rare diseases, like advanced therapies, gene therapy development, like translational research for new types of clinical trials, like big data and real world data for accelerating the translation of results of the research to the healthcare, digital solutions, new types of digital solutions, artificial intelligence. I'm saying that because I'm extrapolating from what took place in the previous work program, Horizon 2020. And there are several types of topics which were not devoted particularly for rare diseases, as also for other diseases, where rare diseases subjects have been selected, proposals have been selected. And also European Research Council, which funds a lot of basic research, has also funded. So I wouldn't say if it will be higher, but you see, I show you the trend, which one can only see when the program will finish, because it's not only the health program, is the digital program, is the other types of programs, innovation, European Innovation Council for small and medium enterprises working on that. So I think there is the new partnership, European Health Initiative, which brings the industry together, where rare diseases is identified in the subject areas. So at least there is a broadening of activities. So if it will be resulted in an increased budget, it's difficult to say now.
Yeah.
But
yes.
Yeah, thank you.
Okay, and so you said it perfectly. Yes, the future is green and digital, so we must be aware of that also for these opportunities in rare lung diseases that we are discussing today. Thank you, Christine.
Thank you very much.
Thank you. Maybe we are all aware that with the COVID-19, it accelerates the cooperation between nations, between researchers, between the scientific community at a large scale. So my question is, if you think that ERN lung, specifically ERN lung that you very elegantly showed us, can benefit from these accelerated mechanisms, and if it is so the excellence of care and the cross-border cooperation that is really one of the aims of this program, if it can benefit from what's happening and that we are assisting even today on the COVID-19.
Yeah, thank you very much for this very clear question. Indeed, COVID-19 is a big threat to all of us, but it is also an opportunity to develop new solutions. And clearly, ERN lung was already established when COVID started. So on one hand, we were ready to respond to some COVID-related threats to our patients. We have been able to build on our current registries to identify people infected, etc. So this is very simple, but very important for our patients. On the other hand, we have been able to develop more virtual communications and more rapid communications between us. It's very strange. The borders are closed, but the communication is very active throughout the borders. And I would say the COVID-19 epidemics has been quite a challenge for rare diseases, for sure, because the patients were a little bit lost because, you know, they were far from their expert centers. But thanks to everything we have built in these difficult times, we now do telemedicine on a regular basis, and we do develop a fast-track communication between experts and patients. And you have seen the webinar we have done on pulmonary hypertension. It was unique. In a few weeks, we had a lot of information. So I think COVID-19 is a big threat for sure, but it is, we were ready to develop our innovations built in ERN lung and offer them to other communities.
Yes, and so with this, we can say that ERN lung can have a bright future, even in close cooperation with the ERS, with the European Respiratory Society, isn't it, Mark?
I wish so. I wish so, and
we all wish so.
Thank you.
So thank you to both of you. Thank you very much for your fantastic presentations and the good discussion. And I think with this time, this is one of the things that we cannot control, time. And I have that feeling at this moment perfectly that it is difficult to control. But it is my pleasure now to introduce you Marlene Fischer from Vienna, Austria, from the Pulmonary Hypertension Association for patients. I have this is something that it is important to be said that PHA Europe is also a co-organizer of this event. And so Marlene will represent the patients now, and the floor is yours, Marlene. Thank you for being here in this event.
Thank you for having me, and thank you for everybody who's been presenting thus far. Everyone's research and input is incredibly intricate and interesting, so thank you for taking the time to tell us about it and for all that you do. So I'm here today to just tell you a little bit about my story and give you a little bit of an example of a patient story with pulmonary hypertension. As we've heard already, it is a very rare disease. So when I was diagnosed back in 1998, I actually happened to be the first European child that received IV prostacyclin in the US, because back then there was no treatment like that available in Austria. And so in order to be able to continue receiving this life-saving treatment, my father had to work very diligently to receive a special import license for that specific medication back in Europe. So that shows you how long ago that was. It makes me feel kind of old too. Back then we took doctors from Austria. One you have already heard a lot about, Dr. Irene Lang, as well as Dr. Manfred Max, all the way to New York to Dr. Robin Barst, so they could be trained in the use of IV prostacyclin. And this thankfully enabled them to pass on their knowledge afterwards at the Medicine University Vienna to various doctors, specifically those in former East European countries. And back in the day, Dr. Barst of the New York hospital, she said that if we were to give her $10 million, she would find us a cure. And during the times of EH cassettes, again, I'm getting flashbacks of how long ago this was, we recorded together with a TV studio a message to send to Bill Gates And because, you know, we didn't want to leave any stone unturned. He didn't get back to us yet, so we're still waiting for a response. Who knows? Never give up hope, right?
Hopefully.
So then with the help of a lot of Austrian celebrities that really supported us, we organized charity concerts. And through those amazing people, we were also enabled to have many TV appearances. And with this type of awareness, it was possible to make many people, opinion leaders, CEOs of big companies, banks, as well as pharmaceutical companies, aware of us and pulmonary hypertension. And I always remember a beautiful story here of a young woman who came up to us and said she always knew that she was sick and something was wrong, and nobody believed her, and doctors couldn't figure out what was wrong with her. And she saw our segment on TV back when I was still a very little girl, and she pointed at the TV and said, "This is exactly what I have. I just know for sure that this is the disease I struggle with." And lo and behold, she was right, and she's thankfully doing very well today. So it's beautiful to know that such a appearance, even if you reach just one person, that could become aware of the effects of pulmonary hypertension and maybe engage in quote unquote early diagnosis, that makes all the difference. And that's like a little life elixir to me, that we were able to do something like that and continue to be able to do things like that. And all these efforts, they resulted in establishing of a research center and the Medical University of Graz, which is now actually a Ludwig Boltzmann Institute for research in the field of pulmonary arterial hypertension. And with actually a budget of that asked $10 million. Of course, now we know that we need much more money in order to find a cure for pulmonary hypertension. But because of early diagnosis and treatment, that is so essential, I've always kind of engaged in awareness work and to, you know, enable the chance for some people to have a somewhat normal life if they're early diagnosed. And so after my graduation, when I was 18 years old, I published a book, which is called Hope Springs Eternal, because it was very important for me to show, of course, children in my age, teens, but really anybody with pulmonary hypertension, that there must always be light where there is shadow, that there are many people out there who are supporting us, and getting the word out about pulmonary hypertension is really the main goal, to get people to understand what it is. So that brings us a step closer to the cure. Yeah, I will conclude by saying that thank you for helping us PH patients, and particularly fueling our hope to be healthy again. Because I always like to say this, healthy people have many dreams, but sick people only have one. So yeah, thank you for all that you do and for your time and tireless effort that you put into the research. Thank you.
Thank you, Malin. It says that I have to thank you. We exist because of you. So I think it says that I have to thank you for this very personalized approach. It was a very important moment of this event. If I may ask you a question, I would like to know what is your opinion while waiting for Bill Gates' answer. What do you think that the European Union could, from their side, could be done more to promote research on rare lung diseases, and also including, of course, life-saving medicine? What should we promote more from the EU side?
So, of course, more publicly funded research projects are the absolute core and needed on the rare disease field to really foster the cross-border research collaborations we've heard about today. So, of course, those are big tasks and big words, but that's ultimately the hope and the goal.
Yeah, of course. So hopefully, thank you, Malin. There is no other questions coming, and I think it's important that we can move. We have around 4 or 5 minutes delay. Thank you for being here in our meeting and for your very interesting presentation. So it is now again my pleasure to introduce you Marion Delcroix. She's the chair of our assembly in DRS, the European Respiratory Society Assembly 13 on pulmonary vascular diseases. And Marion will speak on chronic thromboembolic pulmonary hypertension. So Marion, the floor is yours.
Thank you for the opportunity to speak about this rare disease. This is the content of my presentation. So what is chronic thromboembolic pulmonary hypertension? I will speak about Ctef in the next slides, the burden of the disease, the research on disease mechanism, the timeline of the treatment development, and you will see we have mainly 3 treatments and how we have developed these treatments. And so first, what is Ctef? So it's characterized by exercise dyspnea. We need a right heart catheterization, as you can see, to measure pressure, which should be more than 20 millimeters mercury, with the pressure on the left side of the heart, which is normal. It's also necessary to show that there are perfusion defects, and you can show here that the perfusion of the lung is disturbed while the ventilation, the air coming in the lungs, is normal everywhere. And then the next step is showing very specific images of vessels which are obstructed completely or partially. And this after a normal treatment with anticoagulation for 3 months at least. So what's happening is that we have unresolving pulmonary embolism, as you see here, clots in the vessels, but also after a certain time, the perfusion of the normal lung areas, which are non-occluded, is disturbed with the occurrence of a small vessel arteriopathy. And you see here all these small vessels who should be here are disappeared by the progressive occlusion of the small vessels. And so the burden of the disease is put here in figures. So you have 3% of the patients who present with an acute pulmonary embolism who will develop chronic thromboembolic pulmonary hypertension. We have also, in more than 50% of the patients diagnosed with Ctef, a misdiagnosed initially as acute pulmonary embolism. We have 3/4 of the patients with Ctef who have a history of this acute pulmonary embolism, and we have also the observed incidence of the disease, which is currently measured at 5 to 6 per million inhabitants per year, as we have seen for PAH, as Mark has shown. But we probably have in the populations 3 times more patients who are currently undiagnosed. And that's why the last European Society of Cardiology guidelines on pulmonary embolism has acknowledged that each patient after acute episode of PE should have a routine clinical evaluation 3 to 6 months after to see if they are still symptomatic, and then they need further investigation. So why now does acute pulmonary embolism transform in chronic thromboembolic pulmonary hypertension? So you see here the clots, which are fresh after an embolectomy, which is performed in a patient with very severe pulmonary embolism. And here the transformation of this material, which is fibrotic and which is removed during a therapeutic intervention for chronic thromboembolic pulmonary hypertension, which is called pulmonary endarterectomy. And so there has been a lot of research, of monocenter research, showing that there is a disturbance in the thrombosis fibrinolysis equilibrium. There has been inflammation, splenectomy also is observed, and there is deficient angiogenesis, which has been shown, but we don't know what is the sequence of the events, and it's still a mystery. And we have had temptation to have grants in Europe. So we have made application for the European Joint Transnational Core in 2015. It was a very extensive project which was led by Vienna. And you see, even if the major center in Europe has been participate to the project, we failed to have these grants. And the same happened with the European Joint Program with 2020, where we also looked at this physiopathology and was led by Leuven and also failed. And we have always this thinking that there is a gap for financing rare disease which are not genetic disease, because we cannot offer genetic treatment for this disease. And we still have the impression that we are in a gap, but perhaps our project was just not good enough. Going now more to the treatment development, we see that the first treatment of this disease was a pulmonary endarterectomy, which has been developed and pioneered in at the University of California in San Diego in 1970, which is an operation removing all this material. And we see in European registry that with this intervention, we have 90% survival at 3 years. For the patients who could not benefit from such an intervention, you see that they have only 70% survival at 3 years. But during the last 10 years, you see an immense effort of adding therapies. And so Japan pioneered the pulmonary balloon angioplasty in 2002. They introduced it. Then we had also the CC balloon angioplasty, a bit like the intervention on the coronary arteries. And then we have medical treatment who have been proposed and studied in large studies. And so we have 2 drugs which are approved by the European Medical Agency, now the riociguat and the treprostinil. And then we have here comparison between the treatment with drugs and the treatment with angioplasty. So you see now that globally we have 3 ways to treat this disease depending where the occlusion is. If it is very proximal in the pulmonary artery tree, you use pulmonary endarterectomy. When this is based further, we have angioplasty. And which is a microvasculopathy, we use medical therapy, and we have all this intervention targeting these specific anomalies. And so we move from a binary approach that you have seen initially from operable and non-operable patients to now a global approach involving all the 3 types of therapy we have available. And now moving to the effect of this therapy, they have been evaluated in Ctf registries, and we have the International Ctf Association who has led 3 large registries, first in Europe alone, then worldwide, and finally also a registry on angioplasty who are currently going. And these registries has provided a large number of information on the patient characterization, on the surgical management, on the operability of the patient, on their long-time outcome. But also we are now looking at the worldwide management and also the effect of the first approved medical therapy, which appeared so in 2014. So now all this knowledge has been summarized in the ERS statement on chronic pulmonary hypertension, who has just appeared in the European Respiratory Journal, which reviews the literature and the current practice concerning the diagnosis and management of the CTEPH. And this was performed by 29 task force members, including 2 patients representatives. This statement also has sum up proposal for future research, and you see here 21 points which further need work from us. And if we have not been successful in the European application, we have to take the example of France, which is a large country with a very well organized rare disease plan. And you see there already a 3rd edition of these plans in France. And you have here the Réseau Français de l'Hypertension Pulmonaire, showing you the collaboration between centers in France, and they are available to propose large projects. And they just initiated a project where they will find response for some of these questions. And they have already just finished the race study, which was comparing an approach where you start with drugs and then do BPA, which was more successful than when you do the other one. And they just are starting with a project which is involving artificial intelligence for the detection and the specialist imaging of patients with CTEPH, and also including new trials, including combination medical therapy before the angioplasty. And this is only possible when you have such a good organization. And they are working together, the French PH centers, together with research institute and with private partners in order to make this project available. Of course, the ERS statement also make an effort to show that we need international collaboration for biobanking, for example, in order to do omics study in this disease. And so we hope that this project should be in the scope of future ERG rare disease plan and supported by the RN Lung and the ERS. And we also want to emphasize the importance of the Euro plan on rare disease in order to move the centers and the countries to have better rare disease plan. Thank you for your attention.
Sorry, I was muted. Thank you, Marion, for this excellent presentation, switching to a more clinical focus. If you are happy with this, we can discuss it jointly after the next presentation. So we will be back in some minutes, exactly in 10 minutes, hopefully. And it is now my great pleasure to introduce you. Gabor Kovacs is the co-chair of the ERS Clinical Research Collaboration PACSNet, and I can imagine that they will focus on this CRC. So Gabor, please.
Thank you very much, dear Professor Cordeiro, dear colleagues, ladies and gentlemen. First of all, thank you very much for the opportunity to present you the Pulmonary Hemodynamics during Exercise Research Network, which is also called PACSNet. And I think that PACSNet is a very good example for a true collaborative effort between centers, among centers within the EU and also outside the EU, as we have also colleagues who joined us from Australia, from the United States, and also from South American countries, and of course from Great Britain. I think this may represent a good approach how important clinical and scientific questions may be addressed in rare diseases. So PACSNet is, I'm just struggling with, okay. So PACSNet is investigating the clinical relevance of pulmonary hemodynamics during exercise. And you may ask, why is that so important? And I am convinced that this is really one of the most important clinical questions, because especially cardiologists, pulmonologists, if we see patients, one of the most important symptoms that patients refer is exercise dyspnea. So we have to figure out in many cases what causes this frequent symptom. And indeed, abnormal pulmonary hemodynamics may make exercise dyspnea, and in the background of this symptom, very usually we find early pulmonary or early heart or early pulmonary vascular disease. And we were collaborating already with several researchers from Europe and from outside Europe, and similarly to the effort from Marion on the field of chronic thromboembolic pulmonary hypertension, we also produced an ERS statement on pulmonary hemodynamics during exercise. And as you may see it on the right-hand side, I do not want to go into details for non-experts, but it represents that during exercise, as cardiac output increases, the pulmonary pressure increases. That's very normal, as this is represented by the blue lines, by the blue arrows. However, there are situations where pulmonary pressure increases very rapidly, very steeply, and in this case, this is not normal anymore, and that's why we have to figure out what is wrong in this patient. However, even after this very successful collaboration and producing this ERS statement, there were many important open questions which have been identified. One of them is, what is the prognostic relevance of exercise hemodynamics? If we know that those patients who have this steep increase of the pulmonary pressure, if these patients will develop heart disease or a lung disease or a lung vascular disease. In addition, we also need to answer that if we investigate hemodynamics during exercise, if we have more information as compared if we only examine hemodynamics at rest. And finally, if it helps us to diagnose, to decide what is the reason for the symptoms of the patient. So all these questions are now aimed to be investigated by our clinical research collaboration. So how does it work in practice? We established this clinical research collaboration back in 2017. And during the first period, which was until 2020, so for 3 years, we successfully established this collaboration. We invited 39 centers from 15 different countries who provided very important data on this condition. Until now, we were able to include over 1,500 patients into our database, which is a huge achievement because we have more patients, more data than ever before on this condition, and we have a very good chance that we will be able to answer our questions. We now closed the retrospective arm of the database and analyzed the data, so I hope that within a year we will have our first results. However, we still have the prospective arm, which is open. We have a prolonged support by the ERS during the second period, which lasts until 2023. And of course, we have very important duties within this second period. First of all, we need to continue with the prospective assessment of our patients. And importantly, we have to negotiate a long-term prolongation concept with the European Respiratory Society, how we are able to have new grants, new financial opportunities to support this important initiative beyond the second period. We are very thankful to the ERS because we really receive important and very practical help for these negotiations. In addition, of course, we need to work on grant applications based on the achievements of our clinical research collaboration, and also, of course, by keeping in mind which are the new important research questions. I shouldn't forget patient involvement. You have heard Marlene Fischer, how important it is that patients are also involved in research projects. So we have the opportunity to discuss it with patients' organizations, how to develop patient versions on findings, and how to plan the analysis of relevant questions for the patients, and how to distribute our findings. So in the end, I would like to thank you very much for your attention. I really hope that I could show how this collaboration works, and I hope I could share my optimism with you that we are able, with your help, of course, to find good ways to address important questions together. Thank you very much.
Thank you, Gabor. Thank you for this excellent presentation on the CRC, and Marion, both of you, if you are happy to answer to some questions. We have already 1 or 2 questions, and I can include it in the next 5 minutes. So maybe to Marion, of course, we have new opportunities. It was already raised during this event. We have new opportunities with the new EU programs that are rising now with the Horizon Europe. The question is that, of course, we can have more opportunities, but if eventually the regulatory agencies are not overwhelmed at this moment, and how can we, for accelerating research, face this problem of eventually regulatory agencies being overwhelmed?
Mm-hmm. it depends which level of regulatory agency. And when we look at the institutional ethics, for example, they are overwhelmed. It's clear. So you have months of delay now for having completion of all the administrative procedure for starting academic or pharma studies. So this is clear. At the level of registration of new medication, we don't have for the moment for pulmonary hypertension so many applications. So I'm not sure it's a problem. But anyway, the regulation in se is a problem, as we have heard from the first intervention. The data protection is a problem. We have the burden of the administration. We need fantastic project manager to circumvolute all this regulation, and this is harmful. Yes, clearly.
Yeah. Okay, thank you, Marion and Gabor. So I think there is a nice question regarding rehabilitation, pulmonary rehabilitation. So how can we stratify patients according to being suitable or not for this therapy? Can you say something on that?
I'm mute. Yes. Thank you very much for this important question. It's a very timely and valid point. Pulmonary rehabilitation has been in other diseases, cardiopulmonary diseases, an important issue. And also in our field, in pulmonary hypertension, there have been already some studies showing important contribution to therapy. And this is also a part of the management of the patients. So also here in this field, there is an ERS statement on pulmonary rehabilitation in patients with pulmonary hypertension, which describes very nicely how it should be performed. Maybe just one or two important points from that. It's important that patients who are having rehabilitation should be stable for their pulmonary vascular disease. So it makes no sense for a patient who is unstable and at risk of rapid deterioration to have a rehabilitation. And it has to be a specialized program in a specialized center where there is experience with pulmonary vascular diseases. So it's not the same rehabilitation which is offered for COPD patients or for heart infarct patients. It must be a very specific approach for patients with pulmonary hypertension. But if these regulations, if these suggestions are kept in mind, then patients can profit a lot from it. So it must be a dedicated approach.
Yes. So maybe I can make another two questions, quick questions maybe, that because we have to wait for some moments and we save some time. It was fantastic on the last presentations. We saved time on, and so we have more time for discussion. And while we are waiting for the next MIP4 to be back and to do the closing remarks, maybe I will ask you, it can be for both, the two questions. First, that we know that to submit projects and for EU initiatives and calls can represent an enormous amount of work and time dedicated. And so the question is, if you think that ERS and of course other societies or ERNs more broadly could be somehow funded by the European Union to support such submissions, because it is really a critical moment, and of course sometimes it is not easy to have this kind of programs on time. This is one. The other one is also in the Q&A asking, and I think Marc Humbert would like to answer this question, when will the results of RACE be public? So maybe Marc can enter after you can say something on my first question.
Yes, I can answer you. It's certainly you can support the project at the level of the ERS, but also it's not only a money for having good coordinators, and it's also the education of this project manager to be really optimal. And that in the academic world you have these people, but they are not on one project. They are helping you to apply for the EU, but they are not dedicated to your project. And this is certainly something that the RS could help to form new project managers, new coordinators for this application. That's
yes, it can be important, of course. You have anything to add, Gabo?
But if I may add, I think one of the problem may be, and Marion presented two examples where I'm sure great proposal, but still failed, unfortunately. I am quite sure that many of us could add similar examples. And what I experienced that clinicians, clinical researchers, or also basic researchers have a slightly different language as compared to the other stakeholders who are representing those providing these grants. And I think there is a big need for a translation, that researchers really understand and recognize which projects would be most suitable for their ideas, and to have to choose from this really from the lot of opportunities of different grants, which approach may be the best for their research idea. So I would see here a great need where ERS or ERN may be helpful to make the translation between the two languages.
Okay, and so Mark, are you happy to answer the race question?
Yeah, thank you very much for asking. Indeed, RACE is a major study for chronic thromboembolic pulmonary hypertension, and Marion did a great job presenting all the activities around Ctef. In Ctef, we have different options, and we have presented, in fact, the first results of RACE in September 2019 at the ERS conference. But we wanted to offer the patients a long-term extension in order not to oppose medical therapy and angioplasty, but to see the benefit of sequentially offering one after the other. And last Friday, we presented this one-year extension at the French Network on Pulmonary Hypertension conference, and the article is now going to be submitted to an international medical journal. So it should be available. Maybe we will put it on the medRxiv, or maybe we will wait for the publication. We don't know yet. We will discuss that with Marion, maybe. But maybe it should be available by the ERS conference next fall.
Okay, it's good. Marion, you have something to add, or you are fine with this?
With the race or with the
with the race?
Yes. Yeah, the race is a fantastic
race.
trial. We need such trials. And I repeat that the Organization of Rare Disease in France is an example for all countries. And really, this is something that EU should look at. What are the results of the rare disease plans, which has been asked for?
Okay, so I think that at this moment, I would say that first of all, I think the main objectives of this event, I can say that were perfectly accomplished, because this is really promoting awareness and collecting information to be shared. I think it is something that we have to raise. I'm seeing that someone is raising a hand. I don't know who, asking for a question, but it is not from our main participants. No. So I will at this moment, before giving the floor for the closing remarks, I would like to say that it is fantastic to see that this MIP was launched last October, and it is already the 5th event that it is organized by this MIP. So this is really a very active group, and I think we can be proud of this initiative of launching this lung health program within the European Parliament. But with this, I would like to, at this moment, to introduce another member of the European Parliament, István Juhé, that will make the closing remarks. He's back. He had another commitment, but now he's back. And please, the floor is yours for the closing remarks.
Thank you so much, Carlos. I'm sorry, I was here together with you, but the last 10 minutes, I had to ask some questions from the DG Grow because I'm vice chair of the TRAN committee too. So parallel, I have 2 meetings, but I'm here again, and I was together with you, so I could listening. My dear colleague, MEP Carvalho, dear speakers, dear colleagues, dear participants, dear Mr. Vice President, Mr. Rubalo, dear Carlos. So thank you so much for the kind words and the short introduction. I'm very active on this field, and that's why this is not the first time when I'm together with you. It is a true honor to close such a fruitful and useful event. But to be honest, on the other hand, it is difficult to sum up all that we have heard today, because our respective speakers who highlighted the different angles of the topic, and they all have said everything. It was great to hear Christina and the position of the European Commission, and of course, President-elect Mr. Humbert was very concrete and clear, but the aspect of Ms. Fischer as a patient is also very helpful. And it was very, very touching to listening her. I believe that we should talk about the rare diseases more and more, just like the pulmonary hypertension, and raise our voice in order to get more attention. So dear colleagues, you know very well that the third health program, which was from 2014 till 2022, budget was only 450 million euros. That was before the pandemic. This situation, which has caused by the COVID-19, made an opportunity, and thanks to the European Parliament and the MEPs, the colleagues, the budget was increased to 5.1 billion euros.
Yes, yes.
It was a huge success,
Yes.
but we cannot stop because I think that we have several tasks. You have to know that I'm a new member of the ENVI, but when I was member of the Hungarian government 11 years ago, I was one of the biggest supporters of the health structures. I wasn't responsible for it, but I always asked my colleagues to give more money to the health structures, because without money, we can't give better healthcare service to our nations. So that's why I was very active to have this 5.1 billion euros, and I'm happy to have it. So the first one, we have to, and we will continue to work with the European Commission and the Council to further advance EU research and on rare diseases. Second one, the European Parliament needs to make sure that 5.1 billion euros, the EU for Health program, would strengthen European references networks. And the Commission is totally good partner of the Parliament. I can tell you, I have lots of kinds of practices in the Parliament, but to work with the Commission to have a better European health service, it's a perfect example how the Parliament, the political decision makers, the MEPs, and the Commission have to work together. So it's a good example. I just mentioned it to the DG Grow, where we are working on the tourism. I just mentioned the example, what's happened with the European Health Union project, because with the Commission, I think the Parliament couldn't make this strong resolution and steps. So the third one, we need to work hard as the European Parliament to make sure that the Horizon Europe program is the best it can be for patients with rare diseases. Fourth, the research funding has proven its worth during COVID-19. Therefore, we must ensure adequate funding for research on rare diseases, and this is a very important aim. But you talked about it the last 1.5 hours. The next one, we need to bring closer the patients to the people, and that's why it is important to have speakers like Fisher. Her views can help the other people and the society to understand that the people with rare diseases, what's happening with them. You know that maybe you don't know, but I told it several times in several conferences. I'm a politician and not a professional in the field of healthcare. But as I said last time, when I had the chance to speak during one another MEP Lung Health Group event, please use me, use my contacts. I'm happy to help, and I'm happy to be the face, one of the faces of the cause together with other MEP colleagues. I'm sure she agrees with me, MEP Carvalho, and I hope that we can work together in the future on it. So with strengthening the resilience of national health systems and improving access to high quality healthcare, and with a real and well-functioning European Health Union, we can get more funding and more money to accelerate the EU research for rare diseases. So thank you so much again for the event and your attention. And I hope I can help you in the future too. Let's do it together. Thank you so much, colleagues.
Well, thank you. Thank you. This was a perfect summing up. I will not add anything except to thank all the active participants that were in this event. Again, another event organized by the Lung Health Group. It's important to again stress it up. It's the 5th from October on. And I would like also to say that maybe, of course, the people that were assisting to this event could benefit from what was presented here, because I think it was a perfect link between clinic and science, and also with patients, with the patient's point of view, and with the political overview and the regulation that we can connect between these all partners. I think this is how we can move, and this was the main aim of this event, to move and to accelerate research for rare diseases, in this case for pulmonary hypertension. And I think this aim was completely fulfilled. So thank you to all the active participants. Thank you again to all the people that were assisting from the digital way, and hope to see you all very soon. Thank you to all of you.
Thank you very much. Thank you.
Thank you.
Thank you so much.
Thank you. Bye-bye.
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 Thanks. Bye-bye.